Improving practice productivity and the patient experience with BIOLASE. And I give them a lot of credit. You know, I had not really studied BIOLASE as a company, but as I got to know the company and I saw the suite of lasers with the new iLase coming out and the innovation, that's what we need. We need innovation brought to us. It's not us doctors who are coming out with new products. We need companies that are bringing us new products that we can incorporate to build better practices. So we did all this research at the request of BIOLASE, and we were commissioned to do the research and give them back our findings. So we did doctor phone interviews of laser users and non-users throughout the United States. Levin Group, we used our Levin Group client database. We used our Levin Group consultants' input and review on what we needed to know. We put a team together. And we also used our Dental Economics Levin Group annual practice survey database. So we already had a ton of information on those practices, and we could just add laser information on top of that. The top 3 reasons dentists are not using lasers throughout the country, I thought before I start solving problems, I'll just show you a little bit, are cost, return on investment, and learning curve. Cost. How much does it cost? Well, write this down. It really doesn't matter how much anything costs anymore. It's how you pay for it. That's the key. We're in an era where the total cost is completely irrelevant. The iLase is coming out. I don't know exactly what it'll be, but I'm told it's going to be at a very nice price point. And then you have an easy lase, and then you can go up to a multi-thousand-dollar, tens of $1,000s product. It doesn't matter what the price tag is. We dentists run up to booths at trade shows, and the first thing we say is, well, how much is it? And the answer is irrelevant. I don't care if it's $10,000 or $100,000. It doesn't make any difference at this point. It's how you pay for it. In other words, we're not writing checks for most of these things up front, where it's how we pay for it over time. And that's the way we should be thinking. In other words, when we work with our clients who want to buy lasers or other technologies, we want to know, well, what's the monthly amount? How much can you produce per month? If we can produce more per month than the cost, that's good. If we can produce 3 times, 4 times, 5 times the cost, that's fabulous. It's an easy decision. Buy it. The problem is you're buying a lot of stuff right now that's not getting that return. So ROI, return on investment, is a critical decision. And you can't have every technology out there today. It's too expensive. So you need to focus on the ones that are going to allow you to do more dentistry. That's really the key. Will this allow me to do more dentistry? From the day I buy it, I don't care what it costs, but will I start making back my investment quickly on a monthly basis? And then, how hard is it going to be to learn? How hard is it going to be to master this technique? What we found is the vast majority of dentists can learn to use lasers extremely well. The learning curve. Well, there's excellent training and support. I will tell any of you in the room who have not gone through all of BIOLASE's training and support, you made a mistake. Go back, start over, and go through their programs. What I find is if you get the basics, you can build from there. We met a few people that never quite got the training, they never got the confidence, and therefore they were doing a few procedures, but they were missing the whole picture completely. Number 2, the vast majority of dentists possess the clinical skills to be successful with lasers. All this is a new type of tool. You are amongst the most highly trained clinicians in the world, in medicine, in dentistry. You're really good at what you do, and lasers are something you can master fairly quickly. We make things too darn hard. So lasers came out. They started in the 80s, all the way back to the first lasers. And they were claiming, with that laser, you could cut teeth, you could anesthetize teeth. It didn't do any of the things they said, by the way, the first company. It was not BIOLASE. And the point I'm getting at is that we created this image of laser dentistry, laser dentists, laser practices. It was so scary to so many of our colleagues that they never even wanted to get involved. The fact is, lasers are a fantastic tool. Stuart Rosenberg he's a friend of mine from Baltimore, that's why I keep naming him. He can teach you how to do this stuff pretty easily. I mean, any dentist can learn to use lasers and we have to look at it that way. It's a new tool to do what we do better, faster, and more successfully. And you need to do your procedures. We get it. We go to dental school. I always tell the story about my endo experience. Justin, where are you? I know you're over there somewhere. I don't know if you remember me telling you the story. I never did a root canal in private practice. So Justin's an endodontist, and he's saying right now to himself, that's a good general dentist. I like that kind of general dentist. I never did a root canal in private practice. And why? Because in dental school, my requirement was 3 root canals. I didn't finish any of them. They were all 10, each patient was about 10 years younger than God. So the faculty finished the root canals because you couldn't get through the canals. And I never did a whole root canal. When I went into practice, I did not do root canals. Now, if I wanted to learn a root canal, Justin, I would have done one. It would have scared me out of my mind. I never would have done another one. Because for some reason, we get out of dental school or our residency, and we think, if I can't learn something in 1 or 2 procedures, it's no good, I can't do it, it doesn't work, I'll never master it. But the fact is, you need the 10 to 20 ratio. You're not going to master anything till you've done it 10 to 20 times. So when you get lasers, they work. I mean, why can one doctor do a procedure with a laser and another tells us that they can't? And the answer is, they didn't do it 10 or 20 times. They missed the training, and they didn't do it 10 or 20 times. Okay, now let's talk about this a little bit more. Cost. Return on investment. What does this mean? And that was the learning curve before. Okay. Under cost and ROI, return on investment, patient care. The first priority is excellent patient care. There's no one in this room that doesn't believe lasers provide excellence in dentistry. Okay, number 1. Number 2, practice production. I will guarantee you that lasers can increase practice production if they're properly implemented into the practice. That doesn't mean you get it and you learn a trick word and you learn a little tip. It means you change your systems to make lasers help you be more productive. Again, it's not laser production, it's production with lasers. Number 3, the doctor vision and goals. Some of you go out, you buy stuff, you have no vision for it. If you get a laser, your vision should be to use it in as many places as possible, to use it to help build your practice, to use it to do better dentistry. When I talk to doctors, why did you get a laser? Sometimes they don't really know. They kind of know, but they don't really know exactly why they bought it. They got excited. Okay. Number 1, increase total volume. We want to increase the volume of procedures we do. With the suite of lasers that's now available at all levels from BIOLASE, there's no question you can do this. You can do more dentistry. And by the way, real quickly, there are 2 types of dentistry. I'm now explaining this to audiences as of January 2nd. There are only 2 types of dental procedures. I don't care what the clinicians say. They don't know, I do. Okay? They come up here, they tell you all these procedures. They're wrong, I'm right. Type 1 is production, and type 2 is not production. Those are the only 2 types of dentistry, all right? And now that you have that, understand that under the production type of dentistry, we want to increase our volume. The more dentistry we do, the more our production goes up. Now, if you're clogging yourself up with 81% of your appointments being single-tooth treatment, your production's going to max out early. If you change your systems, if you incorporate, I'm going to show you how lasers can be incorporated to increase comprehensive dentistry, production's going through the roof. We saw it, we got the research on it, and now we're actually doing it. Do more of what you do most. What do you like to do? Do more of it. Justin, if I buy a laser, I won't be doing root canals with a laser because I never did it to begin with. So hence, this concept of laser practice needs to go away, and it needs to be a laser I use to do dentistry. I didn't do root canals before, and maybe it's easier with a laser. I still won't be doing root canals if I were in practice now. I still wouldn't be doing it because I don't do that. Do more of what you love. Do more of what you do most. One of the things I teach dentists is a great reason to build your practice is you can stop doing procedures you hate. I mean, I'll say to dentists, what do you like least? Why do you still do it? Well, I have to. Do you really have to? Would you have to if you were 30% bigger? Well, no, I wouldn't. Well, there's a real good reason to go there. Number 3, more new patients. Lasers are a phenomenal marketing tool. Phenomenal. But it's about internal marketing. We have a 1-year internal marketing program. We're going to begin incorporating lasers into that for people who have lasers. We didn't do it before because we didn't think about it. But it's digital radiography, really great thing. Do you think people are going to run to your office because you have it? No. Or patients going to go, I'm going to tell all my friends you have this. It's getting mainstream. Lasers are still something that fascinate people. They're interested in it, and it solves problems for patients, and that's really important. Higher case acceptance. Case acceptance with lasers is faster and bigger if you have the scripting right. One of the things I explain to people, you need the right systems, and systems function by excellent scripting. Within 6 months, you want every routine conversation in your practice scripted in writing. If you're going to have lasers, you need laser scripting in there. If I call all the offices in this room and pretend I'm a new patient making an appointment, I wonder how many offices are going to tell me that they have dental lasers available for procedures if and when necessary. You know what? I kind of know the answer. It's going to be 1% or less. 1% or less. Call your office as a new patient and find out if anybody tells you that there is even a laser. You know, some of you, your laser practices, you're spending money on laser advertising, and yet I call your office, nobody even mentions that you have one, which is the coolest thing in the world. A laser with 2 or 3 points of what's great about a laser gives me confidence in wanting to be a patient in your practice, whether I need it or not. Okay? So, 3 drivers for laser return on investment. Number 1, we maximize laser usage for common dental procedures. If you have lasers, use it everywhere you can. It is a tool. If you have a laser, use it everywhere you can. You've got different elements of lasers now, from the new BIOLASE all the way up, and you should be using it everywhere. It's unbelievable how great it can be. Number 2, impact to shorten procedure times. One of the things I explain to people is, write this down, speed counts. Now, when I say speed, dentists, and I get it, I'm one of you, dentists think, work faster, rush me. No, not at all. In fact, in 25 years, this is our 25th year anniversary at Levin Group, in 25 years, I've done many, many things, but our consulting group has never asked a doctor to work more hours. Our average client works less hours. In the past, I mean, Bill Flores, a dentist in Elkhart, Indiana, went from $650,000 to $1.5 million in 4 years and dropped a half a day a week out of his schedule. One of the reasons is you've got to look for anything that increases speed. I love anything that increases speed. Lasers increase speed if you learn to use them properly. Not the first day, not the second procedure, not the 4th procedure, but by the 10th and the 20th, you're very high-skilled clinicians. You will master this thing and be able to put it in place. Number 3, lasers represent high value to patients. You will get more patients and have higher case acceptance. By the way, some of you may be thinking, well, I don't need to hear this part because I'm already really good at lasers and I'm using my lasers everywhere. But I'm amazed when we meet your practices and we really do our analysis, we find out there's huge room for growth and development with the lasers, that things you just don't see because you're there every day all the time. Maximize laser usage for common dental procedures, okay? Caries and cavity preps, obviously, crown preps, hygiene appointments, bacterial reduction, root planing, tissue contouring, teeth surgery. I mean, we can just go right down the line. Endo. There are a lot of things you can do with lasers today, and the list is growing and expanding, and it's wonderful. And under maximizing laser usage, here are some quotes from the research that we did. New patients travel long distances to come to my practice because my patients have told them about how much easier routine dental treatment is with my laser. Make a note there. Ask a question. How many of your patients are telling other people about lasers? How many of them even leave with a card as they leave your office that explained what a laser procedure was? Do they walk out with anything physical? Do they get to refer a patient for a no-cost exam as a laser patient? I mean, what are we doing to stimulate growth inside of our practice? Nope, we bought a laser. I do virtually every procedure with one of my lasers. I can accomplish so much in less time. San Diego. Salt Lake City, Utah. What made the difference is that the hygienist wanted to try it, and when she started using it, everybody was really okay with it. Sometimes, we doctors bring something new, our team's resistant, our patients aren't ready. When the team gets on board, that's a big, big factor. Okay? Number 2, impact to shorten procedure times on schedule capacity and flexibility. Less time spent waiting for anesthesia. That is huge. I got to tell you, the 2 most uncomfortable times, if you're still in that room, or while you're waiting for anesthesia. The mobile phone question, can you hear me yet? What's the dental question? Are you numb yet? Okay, we got a whole group of people. Are you numb yet? And then the second part is waiting for, while you're holding, if you hold your own impressions, while you're sitting there staring at the patient who can't talk. Number 2, faster patient, it's horrible. You're sitting there like, just staring. It's the longest 3, 4, 5 minutes, right, in the whole world. It's like sensory deprivation. Faster patient acceptance. It doesn't take as long to get a patient to say yes because the anxiety's gone, the fear is gone. Less equipment to set up. When I look at the video on the iLase, I'm blown away by how little that thing is. Greater control. I collect fountain pens. I got fountain pens, Dave, bigger than the iLase. I do. I got fountain pens that are decorative fountain pens bigger than the iLase. Greater control of hemostasis. I mean, what is our number one enemy in a lot of our procedures? Bleeding, is a big thing. Okay, Greenville, Pennsylvania. Without needing anesthesia, I can take care of 8 to 10 cavities at a time anywhere in the mouth. For a small to medium cavity, I've done the procedure in the time I would have been waiting for the anesthesia to take effect. Costa Mesa, California. Most procedure times have been cut in half, and the fastest is a 20-minute procedure that now takes 5 minutes. We have made our firm grows practices. And one of the best ways of the several hundred ways we grow practices by replacing systems is by analyzing how much time you need per procedure. And we do these procedural time studies. We find out that you don't need as much time, especially if we get the doctor back to doing dentistry and let the team have the systems to run the office. And we pick up a lot of time. In fact, we often pick up over 30 days a year of doctor production without you working one more hour. The laser takes this to a whole new level. So in addition to what we've been doing all these years, with a laser, we pick up more time because you're faster. Speed counts and you're not rushing. West Jefferson, North Carolina. I use the laser to do more things I hadn't done before. Procedures that used to disrupt the schedule don't anymore because they're easier with the laser. Lasers equal more value. Remember I said the consumer today wants value. Because you have lasers, if you're not booming in referrals, you're blowing it. More patients, higher case acceptance, okay? Less or no pain. Wow, that's a big thing. There are a lot of people who do think to themselves, I got the money, I've got the time, do I want to go through this, right? How many of you in this room know you should exercise, but you don't? Put your hands up. Come on, hands way up. There are a lot of hands here. Now, why? Because you don't have the time? That's garbage. You've got the time. Anybody can exercise because you don't want to. You don't like it. Nobody likes being a dental patient. Justin, how many of your patients come in the morning and say, I had so much extra money this week, I thought I'd get a root canal. You hear that a lot these days? Nobody likes dental care. Nobody really wants to spend. See, we forget. We think we're so important to the world. In one way we are. We forget that dental patients would rather spend their money somewhere else. Starbucks, Neiman Marcus, a cruise. I can think of a lot of places I'd rather spend money than a dental office. So when they come in, sometimes, like the people who don't exercise, they just don't want to go through it. It just seems like something they don't want to do. Less or no pain. Fewer or no injections. Patients, I will tell you, and just like you all, I think my injections were pretty painless. I was really good at giving injections, okay? Stay away from the palate, and I was really good at giving injections. And then we came out with the wand. The wand was this revolutionary thing that was going to give painless injections, except that it took, a long time. It never caught on because it took too long to give the anesthesia. So, but fewer or no injections. Wow, patients are still scared of needles. It starts with our pediatrician, and it goes till the day we die. And, if we can say no injection, my God, we're meeting practices, though, that don't even say that. They just don't give the injection. They never tell the patient, we're not going to give the injection. They don't even get the benefit of it. Less or no drill. The silent drill would be the greatest advance in the history of dentistry. You all have them in your practice. We call them lasers, okay? Shorter procedure time. We can move faster, speed counts, and faster healing. Wow. If you've got something, if I came in today and said, hey, I have a new technology that you've never heard of, and this is what it does, how many of you would be buying it? You'd be running over to a booth, if I had one, to buy it. You wouldn't even ask what it cost. This is so compelling. We've got it. We have to tell the whole story. And, of course, progressive technology, because lasers come out of comic books and Star Wars, and they're good things, and they're advanced, and they're science fiction. And you know what? Now they're reality, and people love to hear about it. They really love to hear about it. Elk Grove, California. Patients appreciate that they are receiving the best care and technology available. It gives them value in our practice. Tremont, Pennsylvania. Internal patient referrals have gone through the roof. Okay, so let's get some practical stuff. Whenever I speak, I like to bring practical information to you. 20 ways to increase case acceptance with laser dentistry. These are for the patients you've already got. Number one, increase the amount of elective dentistry relative to annual practice production. I got to tell y'all something. I've got the numbers. We've had 25 years, 20 years of implants, 25 years, 20 years of cosmetic dentistry. We know a lot about occlusion today. I was a Pankey Institute person. I went through all their programs. I learned a lot about occlusion. We got a lot of information today, and here's the truth. Before the recession, the average practice in the United States had less than 7% of its production in elective dentistry. Now that is a wake-up call. Three key statistics. One, less than 7% of most practices have their production in elective dentistry. Two, 81% of all dental appointments are single-tooth treatment. Three, you've got a 30 to 50% growth potential without adding any major fixed expenses. What does all this mean? It means that we are not